Hi, my name's Dr. Noreen Grant and I'm a GP with a specialist interest in respiratory medicine. And now what that means is that I specialise in patients with asthma, COPD, or patients who are struggling with symptoms such as breathlessness and chronic cough. If we break it down into what is asthma, because I think a lot of people have been told historically that they may have asthma or the diagnosis is in question and they're never quite sure. Asthma is an inflammatory condition of the airways. So what does inflammation mean? I describe it to my patients like your lungs are on fire. So there's inflammation, there's narrowing of the airways, which can cause symptoms such as breathlessness and wheeze, and also that can cause mucus production, which is what causes patients to cough up phlegm. In contrast, COPD is a more chronic, long-term condition. COPD can often present with breathlessness, cough. Those patients with COPD can develop COPD following smoking, or even from having a lifelong diagnosis of asthma that's not really been managed as well as it could have been. Yeah, so the main symptoms that could highlight that you would need to see me as a GP with a respiratory specialist background is cough, breathlessness, wheezing, tight-chestedness, whether that be at night time or during or after exercise. Well, we would normally say that any cough lasting over 6 weeks generally requires investigation in the absence of any infection like a cold. And so if you're experiencing those symptoms going on, then that would be a sign that you may need some specialist investigations. When you come to see me, you could expect me to take a full detailed history, would do an examination, and we would likely do some breathing tests for you, which is arranged very quickly through Midland Health. We can also arrange any blood tests that you may need and also scans as well. When I come up with a treatment plan for a patient, the most important thing is to make it personalised for that patient and based on the latest evidence base. And we would talk together about different inhaler choices and what suits that patient for their specific needs. I often see patients who've really struggled with their symptoms for months and months and sometimes years and years. And actually I say to those patients, come and see me, come and find out whether there is something that we can do. I want my patients to live well and breathe well and do things that they want to do. Go to the gym, go to the park, run around after your children. And similarly, I see children as well. If your child is coughing after they're running around in the winter or having prolonged coughs after viruses, or their teacher notices they're coughing in the playground or in PE, that might be the sign that actually, could there be something we could do about it? So it's not interfering with your lives. I love working with them to help them feel better and get back on track. And when we provide them with the right treatment for them, it's wonderful when I see them and follow them up for me to hear that actually they're back doing the things that they love to do and it's not interfering with their lives as much. So if any patients are experiencing any of these symptoms or would like to have a discussion about how I may help them, they can find out more through my website, which is asthmaairwaysgp.co.uk, and they can book through the Midland Health website.